tell me what's going on today on Fox News and what topics we're going to be covering and what's the message out there.
You know, David, you just talked about screening, and it looks like our first topic today is something called VirScan, VIR-SCAN, and it looks like we're going into a whole new world, brave new world of screening, because it looks like from this research, and it's pretty promising, we're going to be able to tell what viruses that you've been exposed to over the course of your life. It's kind of like if a crime is going on, we can follow the person by person that we think committed it. But if we have DNA analysis at the crime scene, we can go in reverse and have a much clearer idea who done it. So this is kind of one of these whodunits for medicine. And if I know what viruses you've been exposed to, I can, predict what autoimmune diseases you're going to have, maybe even what cancer you could get, because if you had hepatitis viruses, that decreases your risk of cancer. Multiple sclerosis has been considered to be an autoimmune disease that has some kind of virus that triggers it. We never know what virus it is. Mapping the viral genome, or figuring out what they call the virome of people, what viruses they've been exposed to over the course of their life, using a DNA fingerprint of sorts, is an extremely exciting advance.
So, Mark, is this test, the VirScan, is available right now?
It's not available right now. It's going to be available soon. It's just going through research studies. The study we're going to talk about looked at over 500 people around the world. It's being studied at Harvard, but it's not yet in the doctor's office. It should be soon, though, over the next year or two.
So we're talking about a test called VirScan, and it's a blood test that looks at the DNA, and it can give you the history of what viruses you've been exposed to. Why is that important? Because some of the viruses can have detrimental effect on your health, and it can cause other things. And if you know that history, it could be prevented. And personalized medicine is the way to go.